Hey there, welcome back to NutriFit Hacks. Today, I'm going to break down what a chemical pregnancy is and what causes it. Understanding this can help you navigate these challenging times a little better. So, what exactly is a chemical pregnancy? It's a type of miscarriage that happens within the first 5 weeks of pregnancy. And yes, it's quite common. About a quarter of all pregnancies end before the first 20 weeks, and nearly 80% of those miscarriages happen early. But just because it's common doesn't make it any easier to deal with. Mixed emotions after a miscarriage or chemical pregnancy are completely normal. Some may feel a sense of relief, but for those of you trying to have a baby, a chemical pregnancy can be devastating. It's important to remember that having a chemical pregnancy doesn't mean you won't be able to carry a baby to term in the future. Now let's dive into the causes. During the first 5 weeks, an embryo produces the human chorionic gonadotropin hormone, or HCG for short. This hormone gives you that positive result on a pregnancy test. If the embryo stops developing, your HCG levels will drop, leading to a miscarriage. There's no exact reason why an embryo might stop developing. It could be due to a problem with its genetic makeup, or DNA. Sometimes, the embryo just doesn't implant into the uterus lining the way it needs to in order to grow. Your odds of experiencing a chemical pregnancy increase if you're 35 or older, have an atypically shaped uterus, have hormone levels that are too high or too low, have a sexually transmitted infection, or conditions like thyroid disorders, diabetes, or polycystic ovarian syndrome. So, what are the signs of a chemical pregnancy? Some common indicators include a period that comes about a week later than usual, a positive pregnancy test followed by a period, a positive pregnancy test that turns negative a few weeks later, or a positive pregnancy test without the usual signs of early pregnancy. While you can't prevent a chemical pregnancy, there's a good chance that the next embryo will develop without any problems. Everyone processes miscarriages differently, so don't hesitate to talk to your healthcare provider about your loss. They can also help guide you toward the next steps. Remember, you're not alone in this. Take care of yourselves, and thank you for watching NutriFit Hacks. Make sure to subscribe for more helpful tips and information.